Hello, I'm Jonathan Horiuchi, non-invasive cardiologist with Hunterdon Cardiovascular Associates. In my third year of medical school, I was in a clerkship and my father had a heart attack. And I wound up going from the clerkship back and forth to see him in a community hospital, and he got better. But even after going to medical residency, I wasn't still sure what I wanted to pursue. But soon after getting into medical residency, the patients with cardiology problems are again the ones that I was most attracted to. And soon after that, I decided to pursue cardiology fellowship. In cardiology, we're presented with patients with life-threatening conditions, and our current diagnostics and treatments allow us to get them better in a finite period of time. I also enjoy taking care of patients who have more chronic conditions, and our treatments are also very effective, and I get to see these patients over a longer period of time, and this is very gratifying as well. In my practice, I treat many patients with coronary artery disease, which is the leading killer of Americans. I also treat a lot of patients who have congestive heart failure, which can be a result of their coronary artery disease, or they may come to that condition from other paths. Many patients I see are patients with atrial fibrillation, very common arrhythmia in our aging population. And many patients come to see me to be treated for risk factors that could lead to these conditions. My patients with coronary disease are guided through a number of diagnostic tests. I manage them with medications, and sometimes they will be referred to my partners for intensive management of their disease. My patients with heart failure are often seen in our heart care program. They are monitored very closely in order to keep them out of the hospital and keep them symptom-free. My patients with atrial fibrillation may be managed with anticoagulant therapy when appropriate. Some of them I will need to cardiovert, and some of them I manage with a procedure called an ablation. My risk factor management patients are evaluated to see what they need to have as far as treatments to lower their risk and prevent their first heart attacks and strokes. I approach every patient in about the same way. I listen to them very carefully. They often will tell me what's wrong with them. Sometimes I need to guide them to give me a little bit more information that will help me. I examine them and look at their test results, and will determine what is their problem. And I also try and communicate very clearly with them what I see as their problem and what they need to have done. For the last several years, I've been the medical director of the cardiac rehabilitation program at Hunterdon Medical Center. There, we have offered a program called Intense Cardiac Rehab. It's based on teachings and research by Dr. Dean Ornish. There are 4 pillars in the program. One is a plant-based diet, one is regular exercise. A third is a very important component called stress management and relaxation techniques. And the fourth are group meetings where the patients connect and communicate with each other. This program has shown great strides in managing the patient's disease. They feel much better, and they stay with these changes for a long period of time.